So we started with milk with Ed, and we're going to end with milk. Don't forget the milk, with future memory. We've bracketed our program with this topic, and also with the folks who are full-time at the MedStar Institute for Innovation. It's going to be Raj Ratwani, our scientific director of the National Center for Human Factors in Healthcare, as well as an assistant professor of emergency medicine at Georgetown University. Raj? Welcome to the MIT stage.
So thank you, everybody, for sticking around all day. I know it's been a really exciting day, and it's sometimes hard to make it to the end, so I appreciate that. So I want everybody to take a second to think back to the moment they woke up this morning. What was the first thing that popped into your head? Does anyone, before I ask people to share, I know we're out of our normal work days, but keep it safe. So safe for work comments. Does anyone want to scream out a couple things that popped in their head the moment they woke up? No? Okay. So I woke up at about 4:37 this morning spontaneously, and the first thought in my head was, I need to polish my shoes. And so I get up and I start going through my closet looking for stuff, and my wife yells at me and says, why on earth are you digging through your closet? I tell her I need to polish my shoes. She convinces me to come back to bed. And as I'm trying to fall back asleep, I'm sitting there going, why on earth did that pop into my head? And then I remembered that all of these and my two forum talks are video recorded. And about a year ago, my mother had asked me for a copy of the video recording because she wanted to see what I was talking about. And I sent her the video, and I get a one-line email response from her that said, don't forget to polish your shoes before you give a big talk like that. So all of that drove it. And I never did it, and I needed a way to apologize for not polishing my shoes, so I apologized. And now it's video recorded, so I can send it back to her, and she sees the apology. So that was a long way to get there, but if I would have stood up here and said I apologize for unpolished shoes, you're going to wonder, why is this guy saying that? But we got there now. And for those of you that attended last year's forum, you may recall that the theme was storytelling. And I'm a big fan of blending the past with the present, and so I want to start with a story about memory. And this is a personal story that is about me, my family, and in particular, my 2-year-old daughter named Maya. And if I had to describe Maya in 2 words, or if I had to describe 2 qualities of Maya, the first one I'd say is she's incredibly happy, the happiest child I've seen. I'm obviously biased, and who knows where she gets it. It's certainly not from me or my side of the family, but incredibly happy. And the second quality of most 2-year-olds, and particularly Maya, is that she's incredibly curious. She loves to get into every single thing. It doesn't matter what it is, she's going after it. No matter what child protections and locks you put on it, she's going into it. And about 16 days ago, Maya's curiosity got the best of us. We were all shopping on a Sunday evening at a popular home furnishing store, and Maya reaches up for a console table that's resting unsecured on top of a coffee table. And the console table came crashing down on top of Maya. It was a parent's worst nightmare. It was the scariest moment of my entire life, and I can honestly say it's the first time I remember crying in probably 34 years through that initial process of getting her back on her feet and so forth. And so we rip the table off of her as quickly as we can. I pick her up, try and console her. We take her back home, and she's sort of calming down, but it's clearly evident that there's something more significant that's happened, and so we decided to go to the emergency department. So we go to the emergency department, and unfortunately we discover that she has a fractured left femur. And she's, as I said, the happiest child on earth, and you can kind of see it here. She's enjoying her new mode of transportation, and she's occasionally back at daycare and has all the other kids pulling her around, so somehow she's figured out how to do that as well. And as I was thinking back on this care process, over the course of about 36 hours, we had 3 engagements with the healthcare system. And as I was thinking back on all of these engagements, I was thinking about all the information that gets disseminated during those appointments. What does that actually look like, and how does it relate to memory? So I want to walk through a little bit of that. So we started with an ED visit that evening, and of course, right when you present to the emergency department, they ask you a whole host of triage questions and background questions, and that all meshes really well with our concept of memory. It's things that we recall from the past. Is she on particular medications? What happened? Has she had any surgeries in the past? I'm sure most people in this room know that line of questioning all too well. And then, of course, there's some procedures that happen. There's an x-ray and all that sort of stuff. But then when you look at this in more detail, there's a whole host of tasks or events or things that need to happen that are actually future memories. They're things that the patient or the patient's family need to remember to do. Things like follow these particular medication regimens at 2300, at 02, at 5 in the morning, at 8 in the morning. At 9 in the morning, don't forget to call the orthopedist to make the follow-on appointment. That was the first engagement with the healthcare system. We were lucky enough to get an appointment with an orthopedist the next morning. There's the same background questions, that same way that we've talked about recalling things from the past. But then, of course, there's a whole host of future memories. Things like pick up a prescription, remember the medications, no more food or drink after noon because she has to go to an outpatient surgery clinic at 3. All these things that are absolutely critical to the care of the patient are not memories of the past, but are all memories of the future. And it gets worse as we go to the outpatient services clinic. There's a little bit more background information again, but of course, there's a boatload of information now about how we need to care for her over the next 4 to 6 weeks. All those medication type events that have timestamps, but in addition to that, a whole host of information that are more event or activity driven. Things like make sure you check her circulation, and if you see X, do Y. When you change her diaper, remember to do this. And of course, as a patient in this case, I sit there and I nod my head as fast as I possibly can, not really taking in any of that information. And it seems like the faster I can nod my head, the faster we can get out of here and the faster she's going to get better. And then we get home and my wife and I are looking at each other, sitting there going, what the heck did they just tell us to do? And you have to figure all that stuff out. It turns out that all of these future memories that are critically important to patient success and patient well-being have a term in psychology, and they're called prospective memory. And what prospective memory is remembering to carry out future actions. And there's a particular structure to prospective memory, and the structure is this. You first have an intention-setting phase. Okay? Anytime you think, I need to remember, don't forget to, that's intention setting. You're setting up what you need to do at that future time. The second component to prospective memory is what's called the retention interval. This is the period of time that you're going to have to retain that memory. It can be seconds, it can be minutes, it can be hours. Crazily, in my case, it can be a year of remembering to polish your shoes, and it spontaneously comes up. And the third component to all of this is what's called the retrieval context. So this is the time or the activity or the action that's going to trigger you to actually perform that action, right? So it could be things like, when I see Dr. Smith tomorrow, I have to remember to tell him how great this conference has gone or how great the forum is. So it's not a time-based thing, it's an activity-based thing. So I think you see the structure here. Now, it's important to also point out that I've been talking about the patient side. Of course, for every single person in this room, in our daily activities, in our jobs, the way we behave at home, there's tons of prospective memory events. And I want to point to one of those specifically, which it comes from the medical domain, of course, and is more on the clinician or the provider side. Now, most of you are probably familiar with a type of error or mishap called a retained foreign object. And there's a specific instance of that called a retained foreign specimen. So the case that I'm going to talk about is a laparoscopic surgery case where, as part of this more complex case, a small piece of stomach tissue needed to be removed. It needed to be resected. And as I said, it's the first step that needs to be done, but then there's a larger procedure that needed to be performed. So they resected the stomach tissue, and you can't take the tissue out right away. It's safer if you keep the tissue in until you complete the procedure. So they tuck away the tissue to the side. And the surgeon needs to remember that that needs to come back out. Of course, it's a prospective memory event, it's prone to error, and the surgeon forgets. So they seal the patient, and the specimen stays inside of, they seal the patient, and the specimen stays inside of the patient. So you end up with what's called a retained foreign specimen. If we look at the structure of what this looks like, it matches the prospective memory structure exactly as I described it. So we have our intention setting phase. The surgeon sets the intention of removing that specimen once it's been resected. You have the retention interval. In this case, it's the length of the main procedure. And then, of course, we have the retrieval context where the main procedure is complete and the surgeon needs to remember to remove that specimen from the patient. So this is not just impacting patients and the boatloads of information that we ask them to comprehend when they're sitting with us or when they're under our care immediately, but of course it impacts all of us in all of our activities, and there's pretty tragic consequences to many prospective memory failures. Now, I'm going to talk about, I like to do things in threes. So I'm going to talk about 3 conditions for where we're more prone to making prospective memory errors, or we're likely to see prospective memory errors or failures. So the first one is when there's a deviation from what's called a habitual task. So a habitual task is one that we do all the time, and generally we do it the exact same way. So Every time my mother-in-law goes to the grocery store, she always buys 2% milk, but when we come and visit her, she needs to buy whole milk for Maya, and that's a slight deviation from what she does all the time. And under those conditions, you're particularly likely to make a prospective memory error. It's just very, very difficult when we have these very routine tasks. And of course, healthcare is full of all of these routine tasks. And then those occasional instances where we need to deviate. The second condition is when there are interruptions, multitasking, high memory load. Does anybody have a job that does not have those three things? Because if you do, I want that job. So it's everywhere. This is across healthcare. All of us are in conditions where we're dealing with these kinds of instances. What happens when you have interruptions, multitasking, high working memory load is that, one, you don't always do a good job of actually setting that intention, of actually encoding the intention, going back to encoding that Sarah Parker talked about this morning. You also don't do a very good job during that retention interval. It's hard to sometimes maintain that memory if you need to maintain that memory. And the third part of the high working memory load, interruptions, multitasking, is that when it comes to actually retrieving it and executing the action, you may miss the cues and the time to do it, the person you need to remember to do it, and so forth. The third condition for prospective memory failures comes when there's no cues or environmental reminders to actually help us execute that action. So thinking back to that laparoscopic case, remember that tissue was tucked away. If it wasn't tucked away, if it was in sight all the time, you have a very clear environmental reminder of what you need to do. So those are the three conditions where we're most ripe for prospective memory errors. Now I'm also going to talk about three conditions or three things that we can do to improve prospective memory error. So the first one is to set your intention in a very, very detailed format. And this goes back to a lot of what Ed Torrey described at the start of the day. So if you need to remember to take medication at lunch, don't just think, I got to remember to take medication at lunch. Think about, I need to remember to take medication at lunch. I'm going to do it after I drink my first sip of water before my first course, if you're lucky enough to go to that nice of a lunch. But I think you get the concept of what I'm trying to say. Make it as detailed as you possibly can, and if you do that, you're going to dramatically increase your likelihood of successfully executing that prospective memory action. The second one is to use your environment, right? There's a whole field of psychology that talks about the only reason we're very smart is because we can use our environment successfully. So when you can, set up cues in your environment to remind you to perform the actions that you need to perform. For me, I always forget my keys, and so I put them in my shoes. It sounds silly, but I'm not going out the door, at least not in the fall, winter time, without shoes on, and so I have my keys right there. In the case of laparoscopic surgery, you could actually tie a string to the particular specimen and put it in the visual scene or other things with it so that you remember to do that action. So you're deliberately manipulating your environment to force you to remember to perform those actions. It's incredibly strong, and it's very, very easy to do. And the third thing is you can actively refresh your memory during that retention interval. Now, the literature in this space is very, very mixed. There's some support for doing this. So during that retention interval, you can occasionally think to yourself, I need to remember to do X. I need to remember to pick up milk at the grocery store. So use that interval wisely and occasionally remind yourself of what needs to happen. Now, I want to give you these three sort of pieces of how to improve prospective memory, not only because as we go through our days, we want to make sure that we're executing our actions appropriately, but when you're engaging patients and you're talking to them about all of the things that they need to do, which are probably always deviations or very likely deviations from their habitual tasks, from what they're used to doing, you can help frame it in these different ways to help them succeed. And all of us want to help our patients succeed. So I want to end with one of my favorite quotes. And we've been, again, mostly talking about memories of the past, but please remember that memories are the key not to the past, but to the future. Thank you very much.